Hey everyone, it's the Diplomat, and we are on part 39 of the Chris Watts Discovery Read-Through. In this part, we will be going through the official NMS Labs Toxicology Report, as well as the full written autopsy report by William Burson, who is the Certifying Scientist. So this will be a bit of a difficult read for a couple of reasons. One, simply the sheer content of reading about Shanann and the autopsy on her is just hard. The other reason is there are a lot of medical terms, so I do apologize in advance if I get any pronunciations wrong. I'm sure I've gotten several incorrect, but I am certainly not a medical expert, so just please bear with me on that. However, I do suggest, if you can, to go back and look up some of the words if you are interested in understanding a little bit more about what the findings were. But it's pretty clear whether there was something of significance found or if it was sort of typical. I just also wanted to give a quick update that Buster had his surgery recently and is in a cast. I wanted to get this video out to you since I have not put one out in a bit. So I did not pull in Buster's pictures yet, but I'm going to put them in the next video. But he's recovering well, so thank you once again for all the support we received. Just amazing, and Buster's recovering. So I'll continue to share that with you, and again, next video I will provide some pictures. So with that, let's get into the reports. So the first page here is an NMS Labs report. So this says Toxicology Report, issued on August 29th at 5:09 p.m. This is regarding Shanann, and this is reporting to the Weld County Coroner. So what this report first states is there were 2 positive findings in their testing. Those 2 compounds are ethanol, and it also lists blood alcohol concentration, or BAC. So the result for the ethanol is listed at 128, and that is in units of milligrams, and this is from the spleen blood. And the BAC as well is 0.128, and that's in grams, and that is also from the spleen blood. So, as you may have heard yourself already, the alcohol that was found in Shanann's blood was attributed to the decomposition and not to any external source such as drinking. Then it says, see detailed findings section for additional information. Testing requested, analysis code 8051B. Description is post-mortem, basic, blood, and then forensic in parentheses. Specimens received, it lists 2 gray top tubes. One was 8 milliliters and the other was 6.75 milliliters. The collection date and time on these is August 17th at 11:30 a.m. Again, it's sourced from the spleen blood. All sample volumes, weights are approximations. Specimens received on August 21st. So it looks like the blood was taken on the 17th, but not received by NMS Labs until the 21st. Next page lists the detailed findings. Again, it lists ethanol, BAC, and then it lists ethanol again for some reason. Other than the above findings, examination of the specimens submitted did not reveal any positive findings of toxicological significance by procedures outlined in the accompanying analysis summary. Reference comments. 1. Ethanol, ethyl alcohol, spleen blood. Ethyl alcohol, in parentheses ethanol drinking alcohol, is a central nervous system depressant and can cause effects such as impaired judgment, reduced alertness, and impaired muscular coordination. Ethanol can also be a product of decomposition or degradation of biological samples. The blood alcohol concentrations, BAC, can be expressed as a whole number with the units of mg/dl. or as a decimal number with units of grams per 100 milliliters, which is equivalent to a percentage, and then it says W/V. For example, a BAC of 85 milligrams equals 0.085 grams or 0.085 percentage of ethanol. Sample comments. Physician pathologist name Burson, county Weld. Unless alternate arrangements are made by you, the remainder of the submitted specimens will be discarded 1 year from the date of this report, and generated data will be discarded 5 years from the date the analyses were performed. Signed by William Schroeder, Certifying Scientist. Analysis summary and reporting limits. All of the following tests were performed for this case. For each test, the compounds listed were included in the scope. The reporting limit listed for each compound represents the lowest concentration of the compound that will be reported as being positive. If the compound is listed as none detected, it is not present above the reporting limit. Please refer to the positive findings section of the report for those compounds that were identified as being present. So that was the ethanol and BAC above. So I'm not going to go through every single compound listed here, but there are a number of compounds that were tested for and lists their reporting limits. Again, it's important that we focus on what came up positive. So the next page here is an autopsy body diagram, and it lists Shanann Watts and her information. There are a number of handwritten notes, and there's actually a kind of a picture of a body here where there's certain markings based on the findings. However, this information is in the report, so I'm going to go down and read that, as some of the handwritten notes are quite difficult to read. But I checked, and all this information is in the report. We have Michael Burson, MD, PhD, Forensic Pathology Consultant, and this is the autopsy report. Name of decedent, Shanann Watts. Date and time of death is listed as August 16th at 12:05 a.m. This is when it was pronounced, so this does not necessarily reflect. Well, we know it does not reflect her date and time of death, as we know that was the 13th. The date and time of autopsy is August 17th at 10:30 a.m. and lists diagnoses. Now, some of these words are going to be difficult, so please forgive me, but I will do the best I can. I am going to read it for what it is. I am not a medical expert, and I just ask if there's anything in here you're interested in, look up the definitions and do your own research, as I will not be able to provide that type of details. So listed here, diagnosis. History of being reported missing and subsequently being found unresponsive in an obvious state of death in a shallow grave. Asphyxiation due to manual strangulation. Bruising of the left anterior strap muscles of the neck, in parentheses right greater than left, I guess. Mild to moderate decomposition consisting of generalized discoloration, bloating, and skin slippage. 2. History of infrauterine pregnancy, second trimester, largely decomposed fetus and placental unit. Found expelled from the gravid uterus. Toxicology. Postmortem basics, spleen blood. Ethanol, again, 128 milligrams, BAC 0.128. Opinion. Based on the history provided and the autopsy findings, the cause of death is asphyxiation due to manual strangulation by another individual. The manner of death is homicide. Signed, Michael Burson. History. The decedent is a 34-year-old Caucasian female who has a largely unknown medical history at the time of this autopsy. Reportedly, the decedent returned home from a business trip on the early morning hours of August 13, 2018. This was the last time she was seen alive. The decedent was subsequently reported missing on the afternoon of August 13, 2018. Following an extensive search and investigation by law enforcement, the decedent was found unresponsive in an obvious state of death in a shallow grave in rural Colorado. The decedent was pronounced dead at the gravesite at 12:05 on August 16th. Witnesses. Personnel present for the postmortem examination include Michael Burson, MD, PhD, pathologist, and Joey Weiner, autopsy assistant. For a complete list of individuals present at the autopsy, please see the investigative report file held at the Weld County Coroner's Office. District Attorney Disclaimer. At 10:10 a.m. on August 17th, the representative from the District Attorney's Office read a portion of an email which he received from the Public Defender's Office. In this email, the Public Defender has requested that we swab the necks of the children for residual trace DNA. According to him and his expert DNA witness, they anticipate trace DNA being preserved on the neck structures of the children despite being confined in a container of oil, water, and associated sludge matter over the course of several days. So just interesting that request came from the Public Defender's Office to swab the children's necks. Identification by the Weld County Coroner, State of Colorado. Clothing. The decedent is received in a sealed body bag and clad in the following clothing items: a purple t-shirt, a pair of blue underwear, a black bra, a white metal piercing in the left nares. Paper bags are around each hand. Identifying marks and scars, none visualized. Evidence of medical surgical intervention consists of the following: none. Evidence of injury. External evidence of injury. Possible patterned abrasions of the neck and left aspect of the face. See below. Internal evidence of injury. 1 centimeter area of probable bruising on the anterior subcutaneous neck tissue. Bruising of the superior aspect of the right sternocleidomastoid muscle. Bruising of the soft tissue and facial tissue of the surface of the right thyroid cartilage. Bruising of the soft tissue associated with the right horn of the thyroid bone, which is intact. General external examination. The autopsy is commenced at 10:30 a.m. on August 17 on the body of Shanann Watts at the McKee Medical Center, Loveland, Colorado. This autopsy is performed at the request of the Weld County Coroner, State of Colorado. The body is that of a well-developed, well-nourished, although decomposing Caucasian female whose appearance is generally consistent with the reported age of 34 years. The body measures approximately 67 inches long and weighs 144 pounds. The body exhibits mild to moderate decomposition, consisting of generalized discoloration, bloating, and skin slippage. At the time of autopsy, rigor mortis is released in the major muscle groups. Livor mortis is not readily apparent due to postmortem artifact. There is, however, an area of blanching on the right aspect of the abdomen extending along the groin to the right thigh. This is likely consistent with an area of pressure, based on the body positioning at the time of discovery. Head. Head hair is brown, normally distributed although sloughing from the scalp, and measures approximately 30 centimeters long over the crown. Eyes. The eyes are moderately opacified, (postmortem artifact). The irides appear brown. The pupils are equal at 0.4 centimeters. The sclerae are dull and although white. There are no discernible scleral or conjunctival petechia. Nose. The nose is midline although dried. It does not grate upon palpation. Oral cavity. The oral cavity contains natural dentition in good repair. There are no discernible buccal mucosal petechia. The lips exhibit mild drying artifact. Neck. The neck structures are midline and without palpable adenopathy. There is a linear array of variably sized purple-black circular defects which extend from the inferior aspect of the chin, along the jawline, up the left aspect of the face towards the left temporal area. Chest. The breasts and nipples are normal adult female without palpable masses. Abdomen. The abdomen is moderately protuberant and tense. There is no detectable fluid wave. Genitalia. The external genitalia are largely normal adult female. However, the internal genitalia are protruding through the vaginal vault. This likely represents prolapse of the uterus due to pregnancy and post-mortem artifact. Adjacent to the probable uterus is a largely degraded portion of tissue which is unfortunately covered in sandy debris from the gravesite. Upon further examination of this tissue, it is revealed to be a largely decomposed fetus. Gender and age cannot be determined. However, it has the following measurements: crown rump, length of approximately 10.5 centimeters, and a foot length of approximately 0.7 to 0.8 centimeters. There is an approximate 17 centimeter umbilical cord extending to a disrupted placental disc. The membranes are ruptured and covered with sandy debris. Portions of the placenta, umbilical cord, and the membranes will be retained, and the fetus will be transferred to the jurisdiction of CBI for subsequent genetic analysis. Extremities. Upper extremities. The upper extremities are well developed and symmetrical with all digits present. The fingernails are long and in good repair, although markedly dirty with sand and debris from the gravesite. The fingernails are pulled and retained as evidence by law enforcement. Lower extremities. The lower extremities are well developed and symmetrical with all digits present. The toenails are short and in good repair, with the exception of abundant sandy debris from the gravesite. Back and sacrum. The back and sacrum are unremarkable. General internal examination. The body is opened with a routine thoracoabdominal incision. The subcutaneous fat measures 2 centimeters thick at the level of umbilicus. Body cavities. There are no abnormal fluid accumulations or adhesions in any of the body cavities. The internal organs, however, do exhibit marked discoloration and vacuolization due to post-mortem artifact. The internal organs are also markedly dry. Cardiovascular system. The heart weighs 210 grams. The epicardial surface is unremarkable. The coronary ostia are patent. The coronary arteries follow a right-dominant distribution. Sectioning reveals no significant narrowing by atherosclerosis. There is no acute thrombosis. The endocardial surface and papillary muscles are unremarkable. The myocardium is red-brown, firm and without fibrosis. The valve leaflets are thin and pliant. Aorta. The aorta has a normal smooth yellow intimal surface. There is minimal atherosclerotic streaking noted. The major branches, including the celiac, superior and inferior mesenteric, and renal arteries, are widely patent. The inferior vena cava is unremarkable. Respiratory system. The right and left lungs weigh 280 and 320 grams, respectively, and show normal septation. The lung parenchyma is pale tan brown and markedly atelocytatic. There are no masses or gross areas of consolidation. The trachea and main stem bronchi are unremarkable. There are no foreign bodies or masses. The pulmonary arteries are free of thromboemboli. Spleen. The spleen is soft and weighs 120 grams. The capsule is intact, smooth, and glistening. The parenchyma is firm, red, purple, and smooth. There are no infarcts, nodules, scars, or cysts present. Liver and biliary system. Liver. The liver weighs 900 grams. The capsule is intact. The parenchyma is firm and red-brown. No masses are detected. Gallbladder. A thin-walled gallbladder contains one well-formed gallstone. Just so you know, the parenchyma definition is the following: the functional tissue of an organ as distinguished from the connective and supporting tissue. So that's why you see that repeated. It's talking about the functional tissue of any specific organ. Gastrointestinal tract. Esophagus. The esophagus has a uniform diameter and intact mucosa. Stomach. The stomach is empty. The mucosa is smooth, glistening, and arranged in normal rugal folds. There are no gastric or duodenal ulcers. Small and large intestines. The small and large intestines have a uniform dimension and appear unremarkable. The vermiform appendix is not visualized. Pancreas. The pancreas is tan orange with lobular architecture. There is no evidence of hemorrhage or saponification. Adrenal glands. The adrenal glands have a golden cortex and gray-brown medulla. Genitourinary system. Kidneys. The right and left kidneys weigh 120 and 100 grams, respectively. The capsules strip with ease. The external cortical surface is red, purple, and smooth. The cortices are well delineated from the medullary pyramids. The pelvis and ureters are non-dilated. Urinary bladder. The urinary bladder is empty. The mucosal surface is tan pink, moist, and smooth. Female internal genitalia. The fallopian tubes and ovaries are unremarkable. The uterus, 480 grams, measuring 19 by 14 by 2 centimeters, is prolapsed through the vaginal vault. The uterus is opened to reveal a predominantly empty space with membranous fragments remaining. There is also red-brown fluid and discoloration of the endometrial lining. Neck. Traumatic injury has been previously described. The anterior musculature is smooth and dull. The epiglottis and hypopharynx are unremarkable. The hyoid bone and thyroid cartilage are intact. The laryngeal mucosa is unremarkable. There are no masses or aspirated material. The thyroid gland has symmetrical lobes and appears unremarkable. Spine. The spine has normal configuration. There is faintly visible hardware involving the anterior aspect of the cervical spine at the level of CG. There is no soft tissue hemorrhage or other abnormalities associated with this prior surgical site. Skull and brain. Reflection of the scalp reveals areas of congestion and discoloration which are likely associated with post-mortem artifact. There is no evidence of the discrete hemorrhage, contusions, or lacerations. Reflection of the skull reveals no evidence of epidural or subdural hemorrhage. There is no subarachnoid hemorrhage. The brain is markedly soft and discolored, in parentheses post-mortem artifact, and weighs 1,080 grams. The cerebrovascular system has normal configuration. The cranial nerves are symmetrically intact. Serial coronal sections through the brain reveal no areas of hemorrhage, contusion, or mass lesion within the cortex, white matter, brainstem, or cerebellum. The atlanto-occipital joint is intact. The cervical spinal column has normal mobility. Specimens obtained. Specimens. Specimens retained at the time of the autopsy include blood obtained from the spleen. Representative sections of major organs are also retained. Toxicology. Blood obtained from the spleen is submitted to NMS labs for analysis, which we already read about. Evidence. Nico is transferred to the Colorado Bureau of Investigation for genetic analysis if warranted in the future. Swabs. The palmar surfaces of the hands, anterior and lateral neck surface, face. X-rays. AP and lateral views of the head and neck. Bilateral fingernail clippings. Deoxyribonucleic acid blood spot card, DNA. Histology. Sections of the heart, lung, liver, kidney, brain, right sternocleidomastoid muscle, right sternothyroid muscle, soft tissue from the surface of the right thyroid cartilage, and right lobe of the thyroid are submitted for histology. Microscopic examination. All tissue sections examined show marked postmortem autolysis. So that's where we will end this part on Discovery page 1008. We have made it through the 1000 mark, so I thank you for being here along with me for this journey. It is pretty amazing to be here with you, and when I'm reading, I think of you all. So this was difficult in the sense of what we just read regarding Shanann. It breaks your heart to the nth degree. And, I don't have a lot of information that I can provide in retrospect, but it does seem like there was very limited amount of findings here with regards to the toxicology as well as the overall autopsy. Obviously it was very difficult to read about Nico, and it just, I don't know. I don't have much to say. But rest in peace, Shanann. We're very sorry. In loving memory of Shanann, Bella, Celeste, and Nico. And God please bless the Rusek family. This is The Diplomat. Have a great day.